thank you for joining us today. In the Legislative Building in Regina, we will have Premier Scott Moe and Finance Minister Donna Harpauer. Joining us on the line for the first half hour of the press conference will be Saskatchewan's Chief Medical Health Officer, Dr. Shahab. He has a previous commitment at 3 p.m. this afternoon, so if there are any questions addressed to him that we're unable to get to, please send those to the Ministry of Health media team at media@health.gov.sk.ca. This is a 2-minute warning. Good afternoon, everybody, and thanks for joining us here today. In the Legislative Building in Regina, we have Premier Scott Moe and Finance Minister Donna Harpauer. Joining us on the line is Chief Medical Health Officer Dr. Shahab. He's only on the line for the next half hour. Again, if we miss any questions that are directed at him, we can follow up with those after the press conference. Premier Scott Moe will have an opening statement, and then we'll have about half an hour for questions today. Premier?
Well, thank you very much, and I'd like to welcome the Minister of Finance, Donna Harpauer, here today, as well as Scott Livingston and of course, Dr. Shahab on the line. Today we have a number of different announcements. First, I'd like to announce we are reporting 6 new cases today, 4 more recoveries. So we continue to monitor the outbreaks in the far north and in Lloydminster, and we are doing some aggressive testing and contact tracing in each of those communities so that we may be able to identify everyone who has contracted COVID-19, to have them self-isolate, and then test anyone that they have come in contact with as well. In a moment, I'll be announcing a number of further steps we are taking to protect some residents of northern Saskatchewan, but before I get to that, I do want to announce a new financial support for workers helping Saskatchewan's vulnerable citizens through this pandemic. We will provide $400 a month, a temporary wage top-up for a number of essential workers who currently earn less than $2,500 per month. This benefit will be provided for up to 16 weeks and will be retroactive to March the 15th. Anyone working in private and public seniors care facilities, home care settings, as well as licensed childcare facilities, as well as our community living service providers. Many of them, for example, those that are working in group homes that are run by community-based organizations, emergency shelters, and transition homes. They will all be eligible for this wage supplement. The benefit will be provided to anyone working in one of these facilities, full-time or part-time, who is earning less than $2,500 a month. And this will include workers, that also cooks, cleaners, and anyone who works in those facilities. We want to thank them for the care that they are providing our family members. This benefit is being provided to recognize the important contribution that these workers are making by going to work and supporting our most vulnerable residents at this very challenging time. It's worth noting that many residents in these facilities would normally receive much support from family members. But of course, given today's COVID-19 response, that's not possible with the restrictions that are in place, making the work of these essential employees even more important at this very challenging time. We expect this wage top-up to benefit about 35,000 Saskatchewan workers that will be eligible. It will have an estimated cost of about $56 million and will be cost-shared by the provincial and the federal governments. Today, our government is also taking action to ensure that childcare is available for those who need it as we begin our Re-Open plan. Back in March, when we closed our K-12 school system, school-based childcare centers were allowed to remain open to provide childcare for our healthcare workers and a number of others that are providing essential services during our response to this pandemic. For example, social workers, police, firefighters, correction workers, as well as some of our public utility workers. The good news is that we have been able to accommodate each and every one of those childcare requests from each of those families. And we still have a significant number of spaces available in the school-based childcare facilities. So we are going to be opening those spaces to other workers who may require childcare now or in the weeks ahead, as we begin to implement the very first couple of phases of the Re-Open Saskatchewan plan. You can find an application form on the government's COVID-19 website for these spaces, and also on that website are a couple of contact phone numbers if you have any questions with respect to accessing those childcare spaces. Yesterday, the Mayor of Loche and a number of other northern leaders requested further restrictions on travel in northern Saskatchewan, specifically requesting restrictions around non-essential travel between communities and that travel be prohibited. So our Minister of Government Relations spoke to, as I said, a number of northern leaders yesterday as well as a number more today. And as a result of those conversations today, we are ordering that non-essential travel between northern communities is now prohibited. This is in addition to the previous restriction on non-essential travel both in and out of northern Saskatchewan. The communities of La Ronge and Stony Rapids have been exempted from these particular orders, and that is at the request of those community leaders. Our government is also providing $370,000 to northern communities to support these new travel restrictions. $350,000 will be provided directly to the New North organization, the Northern Communities Association, to help staff and to maintain the checkpoints that are in place. An additional $20,000 will be provided directly to the northern village of Loche to support public safety, food security, educational initiatives that are being organized by the community to ensure that everyone is practicing safe physical distancing and self-isolation when required. Our government is also recognizing the hardships faced by seasonal businesses, those such as Northern Outfitters and businesses that are operating in provincial parks. These businesses are now eligible for support of up to $5,000 under the Saskatchewan Small Business Emergency Payment. In addition to that, the government is also waiving lease fees for outfitters for the 2020 season. I would like to conclude today by once again thanking everyone across this province for all you are doing to reduce the spread of COVID-19. I think Saskatchewan people are doing a great job of adjusting to what is a new normal and a new way of life. And this new normal that will likely be with us for some period of time. People are able to leave their house, to go to work, to go shopping, to go for a walk or even a run. Even on a limited basis to visit with a small group of family or friends. We can leave our house as long as we continue to do it safely, following good physical distancing practices. We can do these things, and we can still reduce the spread of COVID-19. So as a province and individually, let's continue to be careful and let's continue to be vigilant with this virus. Dr. Shahab, if you had any opening comments, and then I would be happy to take any questions that may come.
Do we have an opening comment from Dr. Shahab on the line?
Thank you, Premier. I just wanted to again walk over some detailed numbers from today, which again reconfirm that we have very few active cases currently in most of the far north, central part of Saskatchewan, including Saskatoon, and south, including Regina. But of course, we have 2 active clusters in the Loche and Lloydminster. So from that perspective, in general, number of new cases remain low. Further details in the news release. And in terms of the clusters, again, we need to understand that with active case finding, we will continue to see more cases because active case finding tests contacts of a case and others who may have been exposed and may pick up cases with mild or no illness. So that is to be expected. Thank you.
Thank you, Doctor. We now have about half an hour for questions. We'll take our first question from the floor. Staff?
I want to ask about the support for low-income workers. The work they do didn't change before the pandemic, and it hasn't changed, and it won't be changing once the pandemic is done. So why is this added wage just temporary?
Go ahead, Donna.
Yeah. So the federal government introduced this program and asked provinces to cost share and participate. And the intent is to support those that are supporting the most vulnerable. So that is seniors and individuals with disabilities. So when we looked at that, we thought of the group homes and our seniors' homes. And I know for my own family, family members do a lot. Like they will come in and they will, in the case of an adult child with disabilities, they'll take them out for the afternoon, or they'll come in and spend the afternoon with them in activities. They're no longer allowed visitors, and so it is all on the workers within those facilities. And that's also the area where you may see some of your lower income. We added childcare to ensure that those workers that maybe aren't working now will come back and have the incentive to do so. So the vulnerable that we chose is seniors, individuals with disabilities, and the homeless. So we included residential services, so overnight services such as our emergency shelters and transition houses.
As a follow-up, I mean, what these people do, their jobs are not going to change once the pandemic is come and gone, and there are repeated calls to raise the minimum wage, a mandatory 15 or something like this. What message do you think it's going to send to these low-income workers once this added wage support gets clawed back?
You know, there is no doubt there's been conversations on the different federal programs and what that will look like once they all are no longer in place. And no doubt there will, and provinces have had challenges with the fact that they may be somewhat distorting in nature. But this is one that the federal government has introduced that we're just going to partner on.
We'll take our next question from the phone line. Operator?
We have Creedon Martell with CBC.
Hi. Hello, can you hear me?
We got you.
Okay. I'm calling about, I guess my question is for the temporary wage supplement. It was mentioned that this is going to cost about $56 million. I'm just wondering where is this $56 million coming from?
Just a little over 53 million will be straight from the federal government, and a little under 3 million will be provincial.
Do you have a follow-up, Creedon?
Sorry, I couldn't hear that. Could you just repeat the answer?
I'm sorry, a little over 3 million will be from the federal government, and a little under 53 million will be from the federal government, and a little under 3 million will be provincial money.
Okay. And it mentioned that this is for, for the people who look into vulnerable, look after vulnerable populations. Does this include, would this it says shelters and transition shelters, so I'm just assuming that, but I want to clarify, this means like YWCA and, Soul's Harbor, in Regina. Would those sorts of organizations be eligible for, or those organizational workers be eligible for this program?
If they have emergency overnight beds, yes, it would.
We'll take our next question from the floor here. Arthur?
So I see that there's a few key positions that I think we would all agree are essential that aren't on this list. The most outstanding to me is probably grocery store workers. I'm just wondering why you chose not to include them. Even if they aren't in the federal list, you're only spending $3 million of provincial money. Why not add them on, add other essential positions on that are underpaid and that are facing more risks because of the pandemic?
So going back to the previous question of how, as we add on and it becomes more and more distorting, there are a number of companies that have increased the wages to their workers, like the private companies have. Some have, some have not. When you start to expand it into the entire private sector, retail or otherwise, then you're looking at double or triple the numbers of employees that we would have to find, and that becomes then a far more costly program than even the federal government was willing to pay for. And the third problem is, as we open, so is it the workers that are working today? Is it the workers that come later? It just becomes extremely burdensome and difficult. When speaking with the federal government and my counterparts, they did intend this to be those working with the vulnerable population.
Follow-up, Arthur?
One follow-up. I think in the first province to put into place a program like this was actually Quebec, and they called it a kind of retention program. And the point was to prevent some of these workers from actually leaving and creating that sort of problem what we saw in the private care home where it was understaffed. Have you noticed that problem, and was that in any way, was this an attempt to stem some of those workers from leaving?
Fortunately, in Saskatchewan, we do have a number of private care homes for our seniors. We have not had any evidence of workers walking off, which is very fortunate for Saskatchewan.
We'll take our next question from the phone line. Operator?
We have Callie Stefano with CTV.
Hi, I'm wondering what the Premier's thoughts on Council approving this morning that it's going to be sending a recommendation to the province about intervening in the labor dispute between Unifor and the Co-op Refinery in the process of third-party binding arbitration.
Which council?
City Council, Regina City Council.
Okay, I was unaware of that. I'm not sure that there is a place to intervene. As I said yesterday, I'm not aware that this is before the courts anywhere, or there's any way for a council to intervene in what is a private sector labor dispute. So I'm unsure exactly where that intervention would take place. And I think I answered this question yesterday with respect to the government's position.
You have a follow-up, Callie?
No, thank you very much.
We'll take our next question from the phone line.
We have Adriana Christensen with CJME.
Yes, this question is for the Premier. The plan to extend availability and expand child care services for people returning to work in phase 1 or 2, there's still no mention of what will happen for school-aged children. What are parents supposed to do if they're expected to return to work, but their children are 7 to 10, too old for daycares and too young to stay home alone, especially while trying to follow distance learning? And even if they did want to send older school children to childcare, how would you account for that capacity when there is still limited capacity with 8 kids per room?
Yeah, no, well, what we are trying to do is to free up capacity for those that may be looking at getting back to work in either phase 1, phase 2, or even phase 3 of our Re-Open Saskatchewan plan. And that is our goal, is to continue to reopen Saskatchewan. And as we get into phase 3, then daycares will be allowed to expand from their current capacity of 8 children per room and per child care caregiver. The fact of the matter is where there are opportunities for individuals to work at home, and we are still encouraging that to happen. That helps us contain this virus when people are not at their workplaces, but they are actually working at home. And we have a significant portion of the Crown corporations, for example, and the public service that are working at home. What we have found is, and due to repeated inquiries and questions, in fairness, from the media with respect to how can we provide daycare services, if you will, to families that may be required to go back to work, families with even younger school-aged children. We do have 350 non-school-based childcare facilities here in the province, many of which are still operating in some capacity, and we'd encourage individuals to reach out to those home-based daycares that may be right in their neighborhood to entertain and consider a place in those home-based daycares, as well as we have 2,100 spaces in our school-based daycare facilities, of which we likely have about 1,500 availabilities. So we are going to make those available for families that will be choosing to go back to work during Phase 1 and Phase 2 of the Re-Open Saskatchewan plan.
You have a follow-up, Adriana?
Yes, it still doesn't exactly answer the question about elementary age school children who, many of whom are trying to learn from a distance and still would probably are not considered of age to be in daycare centers. For the most part, those daycare centers age out at 6 or 7. What are their parents supposed to do if they do have to go back to work, notwithstanding the ones who can stay home and work from home? But if they do have to go back to work under this plan, what are the parents of these older school-age children from 7 to 10 supposed to do if they don't have childcare?
So I would say, first of all, there's my experience has been there's a number of home-based daycares that would be willing to have a conversation around this age group of children, and I would encourage families to make their own decisions with respect to who they reach out to with respect to their individual childcare needs. If there is opportunities to work at home, as I said, we continue to encourage that. With respect to the time period between the end of the school year and when the Re-Open Saskatchewan would start and when someone may actually start to venture back into the workplace and require this childcare for those younger school-age children, it's a matter of weeks. And I'm hopeful across this province that families will be able to make the appropriate decisions and make the appropriate arrangements to provide childcare for their facilities. What we are doing here today is opening up a number of spaces about 1,500 spaces that we feel will greatly enhance the opportunity for families to access daycare services if they should need them. As I said, we have over 350 home-based daycares, as well as 1,500 spaces at our school-based daycares that we are making available, and trying to do what we can to ensure that families do have access as they make their child care decisions between now and what would normally be the end of the school year, but as well as normal decisions that would be made as they would be in any other year as to how their child care needs are being met throughout the summer months.
We'll take our next question from the floor. Arthur?
So I think during the press conference yesterday, you said, Premier, that you were looking at kind of a geographical you were looking at a geographical differentiation in terms of the north, where in some areas you may see tighter restrictions, in some areas you may see them loosened. But here I only see tightened restrictions with 2 communities exempted. Why should the whole northern region be subject to these tight restrictions when the cases so far are very much kind of concentrated in the Loche area?
Due to the choices of the municipal and Indigenous leadership in the north, of which Minister Laurie Carr had discussions with, I don't think 100% of the leaders, but had conference calls with the vast majority of leaders throughout the north, and we continue to work alongside those northern leaders, not only in the northwest where we have predominantly the largest number of positive cases, but with all northern leaders, and they are supportive of the steps that have been taken here today, with the exception of Stony Rapids, and La Ronge, which have opted to not partake in the travel restrictions, not only going in and out of the Northern Administration District, but also the intercommunity travel. So that's an important tightening of what has occurred today here, and it is in support of supported by Northern leaders. We're asking people to stay at home in the North. We are working with their local leadership in this initiative, and for the time being, and it won't be forever, but we are asking people to stay at home and stay in their community. In particular, in those communities in the Northwest, we are asking people to not only stay at home. This is one area of Saskatchewan where if you can stay at home, not just in your community, but at home, we're asking you to do so. It works in controlling this virus when we limit movement of people, both outside of their home and within their community and across the province. We have shown that. We have a very low number of cases across the vast majority of this province, and I would point to our two largest cities of Regina and Saskatoon that did have a number of cases periodically over the course of the last month, but through very restrictive measures and very close adherence of individuals to Dr. Shahab's recommendations and the public health orders that have been put out, we have in a great degree been able to get a handle on the spread of COVID-19. And we're hopeful that we'll be able to do so in the northern communities as well. The preventative measures in a number of the other northern communities, I think in the community travel, is they don't want to introduce COVID-19 into their communities. If they have a low level, 1 or 2 cases today, or 0, they don't want it in there right now, and they know it is in northern communities, and that intercommunity travel is considered a risk to spreading it into their communities. So I suspect, and I'm aware of the individuals that I've talked to, that's the reason for their support for the travel restrictions to be structured as they are today. There's the other northern communities. We will be moving forward with the Re-Open Saskatchewan Phase 1. Understanding it may have a limited impact in many of those communities when you compile it with the travel ban. And we are also of the understanding that in and amongst these communities, there is a large number of businesses that are operating in the way of outfitters. And so we're including them in some of the provincial supports that we have here today, and trying to work with our outfitting industry as best as we can, understanding that they not only now have lost their international customer base, we're not recommending travel interprovincially, and if they are operating in the Northern Administration District, they are in many ways losing even their provincial customer base. So we're trying to work with our provincial outfitters as best we can.
You have a follow-up, Arthur?
Yeah, I just wanted to know if you have any reaction to the opposition leader calling today for checkpoints on the western border of the province. I know that you said that you were discussing some possible measures, wondering if you've come to any conclusion with that.
No, we haven't had any further discussions with respect to that today. As I say, the interprovincial travel is not being recommended by Dr. Shahab. We have had cases that have come in from other provinces, but by and large, through the adherence to the measures that we have in place, we have been in virtually every community outside of 2 instances at present. We have been able to control the spread of this virus in the province. So we are confident in the measures that we have in place. We're confident in the response to these isolated outbreaks that we are now experiencing, and we'll continue to move forward with the guidance of our Chief Medical Health Officer, as well as the guidance that we're receiving from regional leaders, municipal leaders, and Aboriginal leaders across the province.
Take our next question from the floor, staff.
To the Premier, have you or anyone in your government had any discussions with the CFL at all around Grey Cup planning, and if so, what have those discussions been in regards to?
Yes, I have had discussions, high-level discussions, I might add, with members of our local team, as well as some of their representation with respect to directly with the CFL. I'm not going to disclose precisely what those discussions, we likely know for the most part what they're about, as there is some stories with respect to a request that is put forward to the federal government. I would say that in large part that we would be supportive of the CFL. We did discuss some of the challenges that our Saskatchewan Rough Riders are facing, and some of the challenges that the CFL League is facing. And in this province, the Saskatchewan Rough Riders and the League, well, the Rough Riders in particular, have been around for over a century. It's their 110th year celebration this year, and they most certainly are ingrained as being, part of the fabric of this province. So we most certainly understand that our beloved Saskatchewan Rough Riders, not only are they a strong organization both on and off the field, but they need a strong league to participate in. And so we are going to be talking to other provinces that have CFL teams as well, as we will be talking with the federal government. I understand that there is some communication that will be happening between the CFL and the federal government. And without getting into details, I think it's fair to say that Saskatchewan would, be supportive of those conversations, and we'll see where this goes. But the CFL is in a challenging position, and this is a question for all Canadians.
Follow-up, Steph?
Yeah, have either the riders or the CFL specifically asked your government to provide financial assistance? We know the financial assistance package asked of the federal government, but has this ask been also put to you? No, there's been no ask of the provincial government at this time. But as we know, the provincial government as well as the municipal government has participated in this with this organization in previous years, not only in hosting Grey Cup celebrations, but in the construction of our stadium here in Regina. So there's been no ask put before the provincial government at this point in time, as the ask has been from my understanding from the League to the federal government, and we will work with all of the entities to see where that conversation goes.
We'll take our next question from the phone line, operator.
We have Chris Vandenbrekel with News Talk 650.
Yeah, my question is for the Premier in regards to the response in Saskatchewan's north. Now, non-critical travel has been banned outside of the NSAD, and pretty strict restrictions on travel from community to community, but there is an exception for groceries, especially in a community like Loche where grocery options are quite limited. There's almost a requirement for a lot of residents to come south to get groceries, whether it's to Beauval or some point farther south. Is there any thought to providing more food security for communities like that by shipping large quantities of groceries to the north so that these people don't have to leave their communities and risk spreading the transmission of COVID-19?
Yes, there is some discussion with respect to that, although it is not as simple as it might seem. But I believe our public safety agency, who has individuals on the ground in the community, is working quite closely with the leadership in the community on a number of different challenges, that being one of them. The restrictions that you see here today are, my understanding with my conversations with Mayor St. Pierre, very much supported by the community of Loche. We're working very closely with their local emergency operations center, of which we have provided them today some funding to ensure that we are aiding and assisting in not only guidance but also financially, and ensuring that we can overcome these challenges just like this. Do what we can to support the community's efforts, do what we can to support individuals in the community to have the opportunity to not only access things like groceries, but all the while staying in their community and ultimately and hopefully staying at home as much as they can. We have proven across this province that this virus is manageable, but it's only manageable when we adhere to the public safety orders, or public health orders that have been put in place by our Chief Medical Officer.
You have a follow-up, Chris?
Yeah, I've heard you say that several times, Mr. Premier, about it's manageable when people follow the public health orders. Is there a suggestion there that perhaps these northern communities are not following these public health orders to date?
No, there's a suggestion that there is an isolated outbreak not only in the community of Loche, but also in a hospital in Lloydminster. And I think the indication would be is prior to knowing that you have an outbreak in your community, this virus does spread. And that's been shown time and time again, whether it be at curling bonspiels, whether it be at snowmobile rallies, whether it be in a northern or southern community, quite frankly, or whether it even be in one of our healthcare facilities, namely the Lloydminster Hospital. So this virus does spread when you let your guard down for any moment. And once it is in your community, you have to be doubly vigilant in everything that we do.
We'll take our next question from the phone line, operator.
We have Guy Quenville with CBC.
Thank you. My questions are about the Lloydminster Hospital outbreak, and I apologize in advance for maybe butchering a pronunciation. Yesterday, we heard that the Premier found out about the outbreak on Wednesday, and yet Dr. Nasungu said the Health Ministry was advised on Sunday. Can you please run through the chain of communication on who knew about the outbreak and when, from the point where Dr. Nasungu at the hospital knew on Sunday to the Premier knowing on Wednesday, including when Scott Livingstone of the HSA was, or the SHA was made aware of the outbreak?
I was made aware of the outbreak on Wednesday morning. So Scott, is Scott Livingston on the line?
No, he's not.
Can we do a follow-up with you with Scott Livingston on that question, Guy? Because I cannot speak to the flow of information. The first I heard of the Sunday comments was yesterday during the news conference. But the first that I was made aware of this was Wednesday morning. It's my understanding the first that the Minister of Health was made aware also was Wednesday morning. And we're working very hard to continue to ensure that access is being provided not only to the Minister of Health, but also to the people of the province. This is a conversation that we've been having for a number of weeks now in this room and publicly about how we are disseminating information to the people of this province. And I think there's a responsibility for us to be as transparent, all of us, including the Saskatchewan Health Authority, to be as transparent as possible with the people of this province. In particular, now that we are beyond 1 and maybe 2 cases of COVID ID in many of these communities. In particular, that we are now into an area where we want to identify and isolate, contact trace and isolate any perceived outbreaks quickly, very, very quickly, and as soon as possible. And so I have been in discussions with the Minister of Health on how can we streamline and make as seamless as possible the flow of information, not only to his office, but also to the people of the province. Now, in saying that, we are a very large and diverse province, and we have a very large and diverse health system that offers healthcare services from a community in the far north, like Loche, right down to the very southern rural communities in the province. So there are many differences in how we operate, and there are many differences in the pressures that our health system feels in each of those communities. We're also a health system that has, over the course of the last few years, moved from a number of regions, health regions, operating with some degree of independence, to a single Saskatchewan Health Authority. And I would say that has been a good thing, and that most certainly is proving to be a positive step in our approach to this pandemic, as we are able to reach through a single health authority with very uniform and in a very active way into communities right across the province. Notwithstanding, it's still a work in progress to some degree. So you speak to maybe a challenge that has presented itself here this past week in the flow of information in the Lloydminster Hospital and the cluster or the outbreak that we have there. But we have a hold of it now, and we most certainly are ensuring that we provide all of the supports necessary to not only identify those that have been in contact with those that are positive, but ensure that we are isolating and containing this particular cluster to that facility and to the people that currently have it, and not allowing it to spread into the broader community of Lloydminster, as well as the broader province of Saskatchewan and Alberta. And the sooner we can do that, the sooner we'll be able to move forward with phase 1 of our plan in Lloydminster.
You have a follow-up, Guy?
Yeah, a related question. Mr. Premier, who made the decision not to alert the public once the outbreak at Lloydminster Hospital was initially discovered on Sunday?
I don't know the answer to that question either. As I said, I learned of it Wednesday, and we alerted the public on Wednesday. So I will have to get Scott Livingston to follow up with you either later today or tomorrow.
Thanks very much, everyone. That concludes our time for today.